Update on sustainability and transformation plans. Jim, do you want to just briefly introduce this before Elizabeth adds to the paper?
Yeah, as I touched on earlier on, this is the effort to try and get systems to look not just at their own individual institution, but look at their whole local system, work collectively to look far enough ahead and make sure that we've got a truly sustainable clinical model that delivers the standards that are required in a sustainable way. So, as always, there's variation in that. Some are already in a strong position and will get there relatively easily. Some are going to really struggle because they're in really difficult circumstances currently, etc. But a reasonable amount of progress so far. And on Friday this week, we'll take stock of where those plans are. So that we can tailor our support, NHS England support, CQC support, etc., to help those organisations or those systems get where they need to be, starting from the autumn.
Okay, Jim's summarised the paper.
Is that quick?
that was nice.
Well, let me just, I mean, tomorrow is a very important meeting where we look at all of the STFs, and I will join Jim and other colleagues, and Malcolm will join Simon and other colleagues as we go through these. I think from what I've seen, there is a significant range of progress. Those where I am very, very positive is because you can see the behavioural change of people coming together, working together, local authorities, commissioners, providers, third sector bodies in the same room, working on a cohesive plan for a local health economy. Those where it's a bit disappointing are those where they're barely in the room together. Yeah. Both, they may be physically, but they're not emotionally. And I think we've got to get a real focus on that type of thing. So we will look at this spectrum. It's going to be a major part of our work over the next year. Ruth,
can I ask you, as part of the meetings then, to make sure that mental health features as part of the SDP, so it's not just around an acute hospital, but also our mental health population is being served in an STP's area? Thank you.
Good point. I will do that. Funnily enough, I was at Surrey and Borders 2 weeks ago, and it was absolutely clear that mental health was very closely engaged in that footprint, very, very closely engaged, and it was great to see. But we need to make sure that's the case across the country. I talked to Dominic Dodd this morning at Royal Free, and I asked him where mental health sat within the STP that David Slayman's doing, and he said, it's a slightly more mixed picture. So I think we do have that spectrum, but it's really important.
Yeah, sure. Just to add as well, Ruth, so within the report under paragraph 9 you talked about what we wanted from the initial submission, which, as you'll be aware, some of that was quite high level. As we go through now to the next phase of the submission, we're asking for particular focus in areas where we think that it's been missed out. Also, Jim and Simon and other executive colleagues have obviously been part of these meetings with each of the 44 footprints to go through those initial plans, and each one of those footprints will have a letter that will go back to them with some generic feedback and some specifics about next steps. And earlier on, Jim referenced the fact that it's not all about short term, and this is very much about, obviously, strategic planning. So this process has been running in parallel, and our expectation is that by the time we get to Christmas, and when we're in the process of collecting 2-year operating plans, the 2-year operating plans will just be the detailed part of the 5-year strategic plan. So it'll all dovetail, and that's what we're making. That's why these deadlines are so tight, and we're very.
It's just a thought, actually, arising out of the mental health point that you made a moment ago. It may also be the opportunity to bring an overlay around health inequalities and access to healthcare. And what I was going to suggest is a good connection there would be the Equality and Human Rights Commission did a big quinquennial report last year, Is Britain Fairer? And one big chunk of that, with a lot of underlying data, is around health inequalities for certain groups in society. It's not broken down regionally, unfortunately, I don't think, but it might be worth having a look at that in the context of the plans going forward, just to see if there is some factoring in of particularly important issues in particular locations.
Okay, that's really helpful. Thank you.
Just to agree with all of that, and just building on what Liz said about mental health, but it's the three gaps: health, quality and finance. And I think that in the sessions of reviewing, it would be, I think, really helpful to ensure that all of the gaps are attended to through the plans, and that they are sufficiently radical to take into sustainability, because otherwise that's possibly would be a missed opportunity. And I agree with the chairman that there is, when I was in one of those, we were together in fact, there is huge variability at the moment, and the behaviours and the working together is critical. But I think we would plea from a clinical perspective that the quality gap is specifically looked at in that review.
And you'll be aware, Kathy, from being involved in those reviews, in particular, the finance has been, it's not been a mandatory template, it's been, you know, it's been very light touch to start with. So the focus has obviously, initially, we've been asking health systems to get together to look at the health and the quality gaps first, with obviously sustainability in mind, but that's not been the focus initially.
This is a really, really important aspect of our work collectively and collaboratively with NHS England. I think we should have a fairly high priority on bringing all of this into a development session of the board, probably after October, once they've sort of come through. Because where you go with this is the plan for the local health economy for the longer term. It gets broken down into our 2-year planning guidance process, our money. It comes back to capital and capital allocation, which is going to be very severely constrained. So capital flows to footprints that are not behaviourally or financially or in quality terms where we think they should be, are going to find some of that more challenging in terms of the capital agenda. And it comes down to leadership. And you know, we all know and about how leadership of a system around a local health economy is going to be really important. And we've got organisational leadership. We don't have as much stepping up to that systems type leadership, which is important. As we go through this next process, we're going to be looking quite hard at, have we got the teams in place with the right leadership to do this? Sarah, sorry.
I was just going to build on that, because if you're talking about going right the way through to 2021, that's a long time to keep a plan together when it's not a single organisation charged with it. When you've got a loose grouping and no obvious governance structure around it, it's very hard to keep that level of focus going over 5 years. So I think we're really going to have to talk to these people about how they keep depression going.
I'm interested in views on that actually. Because I of course agree that wouldn't it be great if we magicked an organisational solution to fit to a footprint, each and every footprint. The reality is we're not going to do that, because we cannot do that without primary legislation. I also think that it's a real interesting test, and I'd ask experts in this, Glenn is one of them, that if we cannot do this behaviourally, then we have a bit of a challenge, because the structural solution isn't going to do it anyway. So I'd be very interested in any advice on that. You take, yeah. You're concerned.
I'm certainly not in a position to offer advice here. But one of the things that really strikes me about the conversation so far around the board is the nature of the relationship between the performance indicators that we've been looking at across the entire provision. and the nature of the plans that are being developed in the STPs. And what strikes me really, really strongly is that we have got some ideas, clearly from what you've been saying, about what needs to be done in order to improve performance in various places. The real question then becomes, do we have the mechanism that allows us to ensure that those things that we know are likely to work are then imported appropriately into a particular footprint to deliver improvement in performance, but also against the STP. So the reason I was mulling over the question, and I'm sorry, Chair, I was slow to respond, is actually to do with the time sequencing of all of the things that we've got to achieve here. And then you overlay upon that the leadership problems and issues and potential. So I really do think that there is a lot of exploration that I haven't seen yet about how you move from point A to point B that's over and above the plan. But that seems to be what the core of our business should be about. And part of that, I think, first thing I would want to know about is how we're doing the data analytics. Because building the models that would explain where your intervention needs to be first seems to be fundamental.
Yeah. So that was a very, very nice way of saying you're not giving advice, but giving us very strong advice. Because that was absolutely spot on, I think, in terms of what we need to.
And it fits really well with the discussions we've had recently as Chair's Advisory Group. Earlier this week I had a session with Chief Execs a couple of weeks ago, and so there's concern about all the challenges and everyone being very busy and having to stretch and look very long term and fix day-to-day issues, unlocking very complicated reconfigurations, the need to consult local politics, capital investment, etc. And the data that's supporting these things isn't as strong as it should be yet. So I think for me, tomorrow, a big part of this is about prioritisation, much more focus on execution rather than great plans in many areas. Because in a lot of these areas, they're the same plans they've been for 20 years. They just actually haven't managed to be able to deliver them. Sometimes for political reasons, some capital constraint or whatever. And I think our value is unlocking that and help pointing people to the execution method that we know works because it works somewhere else or it's worked in the past somewhere else. And when we talked about consultation earlier on in the week in a session Ned and I had with Malcolm and Simon, if you're going to do a consultation, for example, you're going to do a really complex consultation, they're really complicated. And frankly, you've got to do a few to understand what you're doing. So there's something about using skills and resource across the NHS more appropriately to support people, so that valuable opportunities aren't missed just because of that. It's the first time somebody's done it. Just go back to a point Ruth made. In the mental health issue has come across strongly in some STPs, and as always in others, it's not really. In some they're really strong players, and others not. And I would say, we go back to some of the pressures on the emergency acute hospital system. The mental health sector shifted the model 15 years ago, but it had a 10-year run at it, and it had a really formal retraction process. That it had invested in other models of care and then closed capacity down and went to the next stage. And times moved on and all that, but it was quite data rich at the time. It was very tangible who did what. I think there's a hell of a lot to learn from that in an acute setting.
So we will bring this back to the board at the next board meeting and then at the subsequent development session, because the next development session is going to be on data analytics technology, and there is some method in our madness in doing it that way around, but it's really poor Pat, sorry.
I wonder if possibly outside the board whether a session could be organised for those board members who wish to attend, just to be taken through these STPs.
Yes.
And we talk about them, but if we perhaps could get somebody could bring a few good ones and a few not so good and explain
Yes.
thinking.
Mm.
But
Yeah.
you might find that
It's,
helpful.
it's one of the reasons I went to some of the interim review stages, and I was accompanied by a pack of paper that high, but it was very useful because you start seeing and bringing these things alive. So we can, if we can organise, that would be tremendous. I wouldn't suggest looking at all 44.
No. Just a sense check. Thank you.
And what we'll do after tomorrow is maybe identify one in each of the 3 or 4 categories of how we're ranking these. Thank you very much.